Hello, everybody. Thanks for joining us for another episode of the ALTUS Chiro and Physio podcast. I have the wonderful Judy Todd with me today. Hi, Judy.
Hello, how are you?
Very well. Thanks for joining us for the first time on this episode series. And I know that you are wanting to unpack a bit about the hip and knee replacement topic on today's podcast. So what's the role of the physio in guiding clients with their joint replacement surgery?
I divide this up into two parts, the before and the after. So before the surgery, I'm quite often already seeing the person who's suffering from arthritis in their hip or their knee. And we know that they're possibly moving towards having a total replacement. So my role as a physio is to keep them as pain-free as we can, keep the pain under control. We know there is pain. That's one of the biggest criteria for getting rid of a joint. So managing the pain and maintaining range of motion. That's the biggie, is that they don't get really stiff before the surgery. Maintaining strength so that they come out with a better outcome. We do a lot of work on gait training. We get people ready for the surgery by working out whether they're going to need a walker or crutches or a cane, and teach them to use these devices and make them safe with their transfers, and make sure that whatever they're going to use is measured for them so they're not at the wrong height of the handles. And then we're getting them ready for post-op by saying, how is your home set up? Do you have stairs? Do you have a family member who can be with you? Where's your family team? Understand that they have to commit to helping you get through this. Things like long handle grabbers for picking things up off the floor. If you're going to get a hip replacement, possibly even with knees, you want raised toilet seats ready to go, raised cushions in your best chairs. So you know that your home is ready for when you come out of the hospital. No surprises when you get home. And then get equipment ready for, you might need cryocuffs, which are the ice machines to help keep the swelling out of your knee. What kind of medications the doctors might be prescribing for you, and how to manage pain with other ways, non-chemical ways. And there's a wonderful booklet that Fraser Health and all the other health districts put out that we make sure that they've got that. And then they will be given that one when they go into the hospital to get their pre-op, which they'll have with the usual pre-ops team of people that they see. Then the big day comes, then they come home. Now we see the hip replacements less often. They're much easier to get through. They usually come to me at about 3 weeks post-op. By when the staples are out, the wound is healing, they're walking with partial weight. The knee replacements, however, we like to see them really early. I'm usually seeing them at about 7 days post-op. They've still got a line of staples in. And then the second time I see them, we've got the staples out and we start gaining range and everything very early on with knees, because they need a lot more work. So our job is to obviously manage the pain, reduce inflammation, speed up healing, return to the pre-anticipated range of motion and strength for their age and ability pre-surgery. Incision management, biggie, making sure that they don't let them get a lot of scar tissue. Basically supervise the home program. These people have to be on a very strict home protocol. So we're going to manage, we know what they're doing, and we're adjusting it, modifying it, and just giving them the encouragement. And eventually they are going to go back to full function. So we help them return to work, sports, whatever is the right timing, because everybody's going to be different. So you can't just check on a website and find out that, oh, I can't get back on the ski slopes for 3 months, 6 months, depending on their age and their previous fitness levels. So that's what the physio is involved with, is the bit before the surgery and then the really important part after the surgery.
That's brilliant. And because I did not know any of this is amazing information for me to know out of my ignorance. I'm wondering if most of the work of physios come post-op, or are there any clients that come in pre-op?
I would say most of my clients have already been seeing me for a long time. You don't decide overnight you're going to get rid of your knee. So these are the people I've been struggling with, and we're getting by the end nowhere fast. So then it's time to make that decision to get. So most of these patients I already know, but a lot I don't. I see them post-op for the first time, and that's fine too. We work it out. But it's kind of nice to have a bit of a relationship with the person first. Then they know what to expect from you later.
I'm curious, Judy, what can a client, you already have a relationship with them, but what can a expect coming into the clinic post-surgery?
If you've had a knee replacement, you can expect it to be quite painful. I won't mess around with that. It is it's a big surgery. I am talking about total replacements, not partial replacements, which are a lot easier, or resurfacing of hips and stuff like that. So I'm talking about where the whole part of the joint is gone and they've got a new prosthesis in on each end. So this is the big surgery. So yes, the rehab is, for knees, it's very tough. For hips, it's a lot easier, but knees do require a lot of strength of character, I think, to get through the, and knees don't just start bending right away. So you have to ask for every degree of movement. You have to work for it. So it's not easy. I'll admit that it's not easy.
What can a client anticipate as far as the outcomes go? I know they probably know this is not an easy ride,
Right.
but what can they anticipate or expect for outcomes?
Down the road, you're going to get rid of the pain that drove you to the hab to see the surgeon in the first place. So you're going to swap initially the pain from the arthritis before the surgery to post-operative pain, but that post-op pain will go bit by bit. It will go more lengthy with knees, of course, than with hip replacements, which are much easier. So along with getting rid of pain, we're getting that range back. We're going to get the strength back, and we're going to get them back to their, what we call ADLs, your activities of daily living again. So these are people who maybe have not been able to push a lawnmower, now they can do that again, or back into sports because they're designed now that we can play sports within reason. So guide the person on how they're going to get back to their tennis or their skiing or their running. Well, we don't often recommend running, but help them back into is certainly extensive walking, hiking, going up and down hills, getting them back to function again. So eventually that will be done without pain. Not always 100% without pain. There are sometimes people who still have pain a while later, but most people do get rid of the pain that they had before the surgery. It's gone.
Would you say, Judy, that's an 80-20 percentage split? 80% can be pain-free and 20% still experience some
It
kind of
depends
pain?
on what you're talking about with pain, because that's very complex. A lot of people have pain. Let's say you've had your hip replaced, but you've still been walking so badly because of the hip that you've now upset your back, and your SI joints, your lumbo-pelvic junction, is all out of whack as well. So you can get rid of that hip, get a nice new hip in there, but you still got the pain from the next joint up. By the time people have these surgeries, it's not just one joint that's affected. So how do you answer that question? Because some people carry on having pain from another joint, but the original pain from that hip, let's say, that's gone. So they might have stressed their knee all the time that they were trying to limp because of their hip. You can't really put a percentage on it.
Judy, my hip has no more pain, but it's still a pain in the behind.
Exactly. Exactly.
Oh, that's great. Judy, what is the cost or financial outlay? Is it covered by insurance? What's your perspective on
If
that?
you live in Fraser Health and you get your hip or knee replaced, let's say at ARH or one of the local Fraser Health hospitals, then you're entitled to go and get post-op physio at that hospital. So the hospital department has an outpatient department that is specialized in helping you get through your hip or knee replacement. That doesn't cost you anything. It's a hospital visit, so you don't pay for anything. At the end of your time, particularly with the knees, the hips, like I say, they breeze through. But I have some patients who've had some physio at the hospital, and then they want to get a little bit more range with their knee, or they're not happy with the stability, or they feel like they want to go a little further. Then they'll come back and see me. Then it's a typical clinic visit where hopefully they have insurance coverage for that. Most of my patients come from Vancouver Coastal Health. So UBC has a program where they don't want you to have to drive all the way back out to UBC to get your physio treatment every week. So they cover for 3 treatments if you've had a hip replaced, and they cover for 12 if you've had a knee replaced. So you come out of hospital with your little piece of paper that we fill in, and we send it back in, and we bill them directly. So there's no cost again, unless you need more than 12. Sometimes people do. Most of the time we can get them done well within the 12. So there's actually no cost on the rehab at all. And you can rent your equipment from the Red Cross, like your raised toilet
Okay.
seat or whatever. You might put a donation into the Red Cross or whatever. So generally, it's not an expensive outlay. No.
Mhm. Judy, in the realm or the world of joint replacement, has there been changes or advances in technology or research
Yeah.
or application that our viewers could glean?
Definitely, right back to starting off with hospital stays. They are way shorter. It used to be back in the old days, you were in for a week. Now, one night, maybe two,
Mhm.
depending on your fitness levels, your age and everything, health prior.
Mhm.
There's way less complications. Hips are not dislocating like they used to. Knees are not getting infected like they used to. The incisions are
Mm.
smaller, both hips and knees, but particularly hips. The incisions are not nearly as long. Recovery time is way quicker. The management of pain is way better. The medications that the doctors and surgeons prescribe doesn't seem to make people as unwell as it used to in the old days. But definitely quicker return to
Okay.
function. And we're starting to see bilaterals going on. That means that you can get, this is very rare, but you could get both hips done at the same time or both knees at the same time. It's not
Wow.
common. You have to go out of province to get both hips done at the same time. I believe there's still nowhere in BC. I know people are going to Quebec to get both hips done, but I've had out of UBC, I've had both knees at the same time. That requires an awful lot of rehab, but that never would have been done in the past. So the outcomes are definitely better than they used to be in the old days, and they're lasting longer. So in the old days, a knee replacement, they say you got maybe 12 years out of this. Now, I'm not seeing patients within 20 years and they still got the same hip or knee replacement. They're lasting longer, made of better materials and less reactions.
That is incredible. As we wrap up today's episode, Judy, what would your best advice be for someone who's contemplating a joint?
First of all, once they've been approved to be a candidate, obviously by their doctor and their surgeon, and they're on the list. I still have patients who stall at that point and say, yeah, no, but I'm doing okay. And I'm watching them walking off and they're barely functioning because they're nervous that when they have the surgery, they won't be in a better place, but they will. So my advice is always go for it sooner than you think, because there's a waiting list. It's 5 months to see a surgeon, a year sometimes before your surgical name comes to top a list. So why wait? These are your golden years. Why wait till you're spiral down, so debilitated that then the surgery is that much harder to go through? So don't wait. These are your golden years. So go fill your boots.
That's wonderful, Judy. Thank you for sharing so much information about hip and knee replacement.
You're welcome.
And for someone who doesn't know anything about it, I'm glad to know
Good stuff. Hopefully it'll be a long time before you're knocking on the door. Yeah.
That's right. That's right. For our viewers who are tuning in, stay tuned next week as we cover more physiotherapy and chiropractic topics with the ALTUS Chiro and Physio podcast.